Hey guys, Dr. Ben here at FA Well Centers. Let's talk about metformin today. Let's talk about blood sugar and side effects, and just side effects in general of medications. We see this so often with lots of different drugs, not just metformin, but it's one of the ones that we come across a lot with patients. And I'll be going through some of those symptoms that we're seeing, some of the problems that we're seeing, even in the literature and the research, and things that you can do in addition to just going, well, my blood sugar's high, I've got insulin resistance, take this medication. So the crazy what's going on with pharmaceutical drugs out there. Just in 2021, so this was even before this whole inflationary cycle has hit this year and everything. And in the first 7 months of 2021, drug prices went up about 16%. We're seeing that the crazy number of price increases. Humira, this is an autoimmune drug that is used for Crohn's, ulcerative colitis, all these things. It is now over $10,000 a month, every single month for these people. So, it's going crazy. So everybody jumping on, pop down below where you're watching from. Love to say hi. Let me know if you were on the autoimmune webinar last night. We had a great time going through that one, and a bunch of people on there. So here's the deal. Pharmaceutical drugs, Marianne says metformin is really bad for you. It's a killer. Unfortunately, it is not the be all and end all, but a lot of pharmaceutical medications are like this because they are not fixing the problem. And drugs are set up to block or inhibit enzymes, or block or inhibit receptors. And all that's doing is it's changing a physiological effect in the body, but it's not fixing the underlying cause. So, hey Mary, good to see you. Gloria, good to see you as well. So what happens when you take a pharmaceutical, you are doing nothing unless, let's say, you've got an antibiotic going into the body because of this bacterial infection, because you cut your foot open really bad and it's getting infected, and you got to do that, or you got an infection in your jaw and from a tooth, and you've got to take that. And you should see what I say for Plavix, 75 out of my pocket. So Terry, PCOS, we'll be talking about that as well. Absolutely, we can make changes there. She does not need to be on that. I mean, especially as a 17-year-old, absolutely not. So we know that there's only a few certain drugs that are kind of, you need that. But even an autoimmune drug, even prednisone, even some of these other things, you've got to figure out the why. You've got to take it down. When we're dealing with metformin is a drug that they use for diabetes, prediabetes, insulin resistance, and even just like Terry and her daughter, we're looking at PCOS, polycystic ovarian syndrome. But if you get down to the underlying root cause, the physiology, even PCOS is insulin resistance, it's a blood sugar imbalance, and it is not just a, you know what, take this metformin and that's going to fix your PCOS, because they're not changing their diet, they're not changing their liver, they're not changing their insulin resistance, they're not using their continuous glucose monitor like every one of our patients, and checking to see what makes that blood sugar go up and what makes that blood sugar goes down. Hey Leah, have insulin resistance, Hashi, hypothyroid, rheumatoid arthritis, kidney stones, absolutely. So this is the perfect case for this, Leah, because you could go to your PCP and just get loaded up on medications. Let's give you levothyroxine, let's give you some type of anti-inflammatory drug for your rheumatoid arthritis, plus some type of a autoimmune drug that's going to suppress that immune system, plus let's give you metformin because of that insulin resistance, and just load you up on a whole bunch of drugs. But there are serious side effects. Metformin, one of the common ones that we see, the research is showing that metformin will decrease the amount of testosterone in somebody's body. And so especially with guys, most people, if they've got prediabetes, diabetes, they're already having some neurologic issues, already having some blood flow issues, maybe some erectile dysfunction, but then they go on metformin and it decreases testosterone even more, and then it even is more erectile dysfunction. They're having less ability to get it up, things like that. But then also in women, if you have low testosterone, if metformin decreases your testosterone, What's going to happen, and this is one of the reasons, Terry, probably why your daughter has been put on that metformin for PCOS, because we will see an increased testosterone, increased DHEA with women that have PCOS. So now, if you're a female and you're going on this testosterone lowering drug, which is what metformin does, you're going to have less muscle tone, you're going to have less motivation, lower libido, not a lot of get up and go and oomph and all that. And so you're already feeling bad because you're pre-diabetic, you're insulin resistant, you're diabetic, all those issues. Now you're being put on this drug that even lowers your testosterone further. So we know there's issues there. We know there's digestion issues. There's a lot of nausea, vomiting, diarrhea, constipation, lots of different issues that way. I've seen, just like Mary Ann says, I've seen kidney issues with patients. We've seen neurologic effects on patients. I've seen muscle weakness. We've seen some pretty major things where people are like, holy cow, I've got to get off that drug. Patricia, 2 daughters and daughter-in-law on metformin, 1 for PCOS, 1 pre-diabetic, and 1 for help getting pregnant. So, that's crazy. They're throwing this drug around like it's candy, and yet no one is talking to your daughters or daughter-in-law about why do they have PCOS, polycystic ovarian syndrome. It is because they have insulin resistance and they have blood sugar imbalances, and they need to stabilize those. Put a CGM on them, put a continuous glucose monitor on, and I guarantee you that PCOS is going to get better. The other one is pre-diabetic. What is that from? Putting food in your mouth that is jacking with your blood sugar. The other one's getting pregnant, and there's probably some hormone imbalances from that blood sugar as well. And so what do we have to do? We have to take a step back and fix the underlying why. Leah used Dexcom 6, awesome, and we use the Dexcom with all of our patients as well, and it is an amazing tool that you're able to reverse, repair, prevent diabetes. Type 2 diabetes is reversible. Absolutely. I'm going to go out and say that right now. Sure, there may be that case where somebody's A1C is at 16 and there's so much damage and they're so far gone. But for 95% of the people, type 2 diabetes is reversible. If we wanted to prevent all the damage, all the destruction that happens with diabetes, it is totally doable. And getting a continuous glucose monitor on your body can do that. How can you tell if you're insulin resistant? Well, you have to do your blood work non-fasting. So many people are doing fasting blood work, but you have to do it non-fasting and check to see what your insulin's doing, your glucose, your triglycerides, your GGT, all of these different markers. I am not sure, Dale and Jane, I am not sure on that one. I'll have to look that one up. I have not seen that in the research. So here's the deal, guys. You do not have to be on metformin. Your loved ones do not have to be on metformin. If it's look at how many kids they're putting on metformin, and their teens and 20-year-olds are going on metformin. That does not have to happen. There's not a metformin deficiency that is causing these kids to go on metformin. If you're 60, 70 years old and you have insulin resistance or prediabetes or diabetes or whatever it is going on with your blood sugar, and you go on metformin, you do not have to be on that. If you move your feet, if you use a continuous glucose monitor, if we do the blood work like we need to, figure out what's out of balance, and go step by step through the process, you can get off the medications and you can have the best life you possibly can and not have to be dependent on other things for stabilizing your blood sugar. So thanks for the shares, guys. Love you all being on here. And remember, there is no amount of medication that's going to fix your underlying root causes. Sometimes they're needed, but the vast majority of the time, it's not going to fix anything. So stay strong, keep your body getting better, and we'll talk soon.